Good afternoon, ladies and gentlemen. Just a small rectification in terms of affiliation. Now I have only two hats, not three.
Not three?
So the Center Public Health and Ecosystem Research is actually a research center under Hanoi School of Public Health, where I come from. So
My apology.
yeah. No, but you are right. I have another one, but it was not. It didn't appear here as a Swiss Tropical and Public Health Institute, but I mean, we therefore don't have place to put everything. Okay, so in 10 minutes, I try to address just a few key points. It was surprising already for me from the first speakers. You know, you talk from the farmer's perspective, and you already put a lot of things about research and policy. And as researcher, I ask myself, you know, how I have to restock a little bit what I prepared before, because you come with a lot of policy recommendations, a lot of data from Ministry of Agriculture, etc. So by the way, the situation in Indonesia and Vietnam, I would say, is not so different, because we are from Southeast Asia. Currently, we share also several points. Even we are not talking Indonesia, Bahasa Indonesia in Vietnam. But the point I want to raise here as the first point is about, the general perception about foodborne disease and public health in the country. And back and forth, I'm involved in the CRP Agriculture for Nutrient Health. It's a CG research program. So the director, John McDermott, is here on the first rank. And actually, we are working in different countries, and we are much more interested in the informal market. I will come back to this informal market later. But coming back to the general perception of the population on foodborne disease and public health issues is, in fact, you see, the evidence for foodborne disease is sometimes quite different between the general perception of the population and the evidence coming from research. So media talk a lot about on this issue of chemical contamination. And now you mentioned about on this food safety and foodborne disease related to sanitation. And just for the information, in Vietnam, we are using animal manure as fertilizer, but we are using also human feces for fertilizing our crop, including vegetable, what is eaten raw. So you see, of course, before using that, you have kind of composting and some pre-treatment, and I understand that in Kunming and South China, they are using also. So this kind of issue sometimes is very important in media, and people care about that, in particular the urban population. But on the kind of emerging issue like antibiotics residues, growth hormones that farmers use for livestock, etc. So now people talk a lot about that, and automatically the policymaker and authority, they address this issue along with the news in media. And from that point of view, it's good that policymakers work on the concern of general population, but we need to see also in another side, and that actually research is needed for that, is to see really this general concern of general population is really the big issue from the public health point of view related to foodborne disease. And for that, I think that we are having opportunities in terms of research to come up with evidences showing what would be the most important or the top issue in terms of intervention where you address the foodborne disease and public health issue in the country. So for that, I think that the resilience, the building resilience from that point of view is much more from the context specific, and we need researchers to work with policymakers. So for some of you, we have heard this point at a side event that I met with John on the first day. So I think that the burden of disease related to foodborne disease is there. It's very important. The system, the reporting system, usually even in developed countries, is we underestimate very much the foodborne disease, in particular in developing countries. So for example, I show here the official data from Ministry of Health in last year, in 2012, we have only 28 deaths and 5,300 cases and 40 outbreaks of foodborne disease in the country. So you see, this number is much less than the data from Australia. And you can ask yourself, for a country of 90 million population like Vietnam, developing countries, compared to 20 million in Australia, there's no reason that we have less foodborne disease in Australia. But the point here is, in fact, that underreporting really, reflects this thing. So Robin, you are from Australia. Sometimes, we can discuss about that. And Ministry of Health try to come up with the causes of this foodborne disease from microbiome 50%, chemical 5%, toxin 15%, and unknown reason 30%. And this kind of thing we have kind of information if you are interested in official data, but reality reflects, shows more than that. So I think this is a little bit background for foodborne disease in Vietnam and how research can assist the policy to address this thing. So now I come to the second point. So that is more coming from our research, not in Vietnam, but I think that we work on different countries, in particular in Africa. The rationale behind that is, in fact, from 80 to 90% the food consumed in developing countries coming from the so-called informal market or the wet market. The supermarket looks clean, and the access is really offered to the high-income people in the country. And of course, when you talk about the quality of food from supermarket compared to informal markets, the general perception is also that you have much better, safer food from the supermarket. So that is the belief. And here in the informal market, how we can regulate and control the hygienic issue on both sides, the food safety in this setting. So of course, the ideal situation is, in fact, you have a kind of a management framework from ministries to regulate this thing. So in Vietnam, we have the law of food safety. You have many seasons to manage the food safety in Vietnam, but unfortunately, it doesn't work. You see, you cannot use all this law and regulation to apply in this kind of setting because people have no incentive to really respect this regulation, whereas the government have very little capacity to inspect or control or reinforce on this policy thing. So that's why in terms of law, we have as many laws as you have in developed countries, but the reinforcement is very different. So what are the alternatives in this kind of setting of informal market? So I think that you can think about many things. But for us, in fact, I can come back to the point. I think very standard to address this thing, the knowledge and the hygienic practice is important in this kind of setting. And how we can manage that? We manage that from the value chain point of view. Now people talk a lot about value chains approach. It means that you have to work with different actors along the value chains, from the people who produce food, who process food, who sell the food, and the one who buy and who consume the food also. This kind of, from the farm to the chopstick approach in Asia, if I would say, is important. And of course, if you do as much as possible with this kind of actors, so the outcome of that at the end would ensure, kind of the safety for the consumers. And here, I would say that the systemic approach that we talk back, we mentioned a lot in this conference is important also. It's not only the meat or the fish you consume along these chains, but also on this impact from the production and processing into the environment that eventually contaminates vegetable and other food. So I come back to the issue of using animal manures, human feces to fertilize crop. So the point here is not only is the community approach, commodity approach of the food, but also other things it happen around to ensure this thing. The second thing, kind of the measure for control for controlling this thing is about the risk management. The risk management to reduce, to mitigate the foodborne disease in this kind of countries is very much related to the people who buy and who consume, who prepare the food. And very often, women play a very important role. It doesn't mean that as men we don't know how to shop and to cook, but in this kind of setting, most of the time women are responsible for buying and preparing food for the family, for the children, for husband, etc. So we consider them as the risk manager. Risk manager is not the people sitting at Ministry of Health, but in the same time, the women in this kind of setting can play also the role of the risk manager. So their knowledge, their practice is very important. for that. So the capacity building, the capability of humans who involved in this chain is important. I saw that only 1 minute left for me. And but we are here to talk about the shock and addressing the resilience. And as Lin Su mentioned from the beginning, the shock for food-borne disease is not something that it attracts a lot of attention, like we talk about climate change, earthquake, and things like this. So here it represents a challenge. Even this thing is the burden of disease. We don't see very clearly from food-borne disease. Sometimes it's very relevant and very important burden we can observe. But compared to other shocks, it's something that we don't perceive correctly or correctly at the level of this risk. And I think that to dealing with the shock, we have the capacity of people before to reduce the shock from the resilient point of view, but also you have the capacity to deal with the shock when it happens. So for me, here's the own issue of health-seeking behaviors. The health system to assist these people, they look for the healthcare services, and also the policy of the country, including all these surveillance systems, but also the policy to manage the food-borne disease is important. And now I would like to close this thing by going back to the point from the beginning, because I'm a researcher, and we can close the loop to have the infrastructure already, the knowledge already, but also the legal framework to manage this thing. So in that, from that point of view, I think that research is needed to tackle the issue on food-borne disease and public health in developing countries. Thank you for your attention.